Lab number 1A, hygiene and skin. First, I would gather my necessary equipment before going into the room. I would wash my hands with hand sanitizer. Upon entering room, I would provide privacy, closing curtains. I would introduce myself. Hello, my name is Monique. I will be your nurse today. Can I see your identification bracelet, please? What is your name and your date of birth?
Alexa, August 1792.
Okay. We're going to start our partial bath. I will be sure to verify orders first. I will explain it as a light sponge bath to the face, the chest, the arms, the legs, and the feet. And we will also be doing oral care. Do I have your consent to continue?
Yes.
All right. So, Alexa, before we begin, do you need to void your bladder?
No.
Okay. So, again, I will do hand hygiene, and then I will apply gloves. I would raise the bed to a comfortable height, lower handrails or side rails. I would place a bath towel over my patient and then move the top sheet from underneath without exposing the patient and disposing of that soiled laundry. I would remove the patient's gown from the unaffected side first, and I would be sure not to hit any IV tubing. I would then have my basin of warm water up to 100 degrees Fahrenheit. I would go ahead and remove the pillow from the patient's head. And I would replace with a towel underneath. Typically, we would have the bed up 30 to 45 degree angle for this. And over the chest, I have my wash mitt that I have created out of this cloth with warm soapy water. We would start with the eyes from the inner canthus to the outer canthus, using separate sections for each mitt or each eye. And then we would start with the forehead. We would do the nose, the cheeks, the ears, and underneath the chin. At this time, we would ask a man if he needs a shave, and for the unconscious patient, we would keep the eyes closed using eye shields and spill any drops or ointments needed. Then we'd be sure to remove any soiled laundry. After this, next, we're going to wash the arms. So what we would do is get a fresh towel. We would expose the patient's arm. We would start by washing from distal to proximal. We would start from the fingers up to the elbow and up from the elbow to up to the shoulder. At this point, we could soak the fingers for 3 to 5 minutes in a bowl of warm water, and we could wash the hands, rinse, dry thoroughly. We could also file and clip as agent policy. And once this is done, we can remove the soiled laundry, and we can try and get our patient to place their arm above their head so we can wash the underarm, the axilla. We can wash, rinse, and dry thoroughly with a separate cloth. We can add deodorant if necessary at this point. Next, we would be onto the chest. So what we would do is we would place a towel over the chest. Oh, that's really okay. We would start by washing the chest, from the neck down. And then what we would be doing after we're done this is, we would be washing the abdomen. So what we would do is we put this towel now on the chest, and then we could pull the bottom towel down to the lower pubic region, and even add another towel there. And then we would wash the abdomen with our cloth and our warm water. We would wash, rinse, and then dry thoroughly again with a separate cloth. When we're all done, we'll be remembering to throw out all our soiled laundry. So we would replace the towel back up, make sure the patient's not exposed at this time. So, and then next, what we'll be doing, we would replace the water, put the handrails up at this time if we needed to. Now we'd be on to washing the legs and the feet. So I would expose the closest leg to me, making sure not to expose the patient too much. I would put a towel underneath the leg, and then we can wash from the ankle to the knee, from the knee to the upper thigh. Rinse and dry with a separate dry cloth. Next, we could wash the feet. We wash in between the toes. We make sure it's very clean. We rinse and we dry again with a separate towel. After we're done, we make sure we cover up the patient properly. Remove any soiled laundry. Put the rails up, and then I can move to the other side to do the next arm and the next leg and the next foot. While I'm doing this partial bath, I can do my assessment of the skin. I can do my C-temps, color, temperature, edema, movements of feet, pedal pulse, sensation, etc. While in this position, we would provide perineal care as well. So for a female, we would have them spread their legs slightly with their knees bent, drape a patient with the towel in a diamond shape over the perineum, cover thighs with bath towel, apply cleaning product, wash, rinse, dry upper thighs, wash labia carefully from front to back, one side then the next. Use separate sections of the cloth, each downward stroke, washing, rinsing, and drying. We need to observe for redness, swelling, discharge, and pain. We want to make sure that the patient is comfortable, warm, and feeling respected for this procedure. Now we're going to wash the back. So if I haven't done so, I would remove my gloves and I would use hand sanitizer, wash hands. I would put on new gloves. I would make sure I have fresh water, fresh clean linens and cloths for myself. I would put the handrail down. I would get my patient to roll to the left side, their left side, while only having their back and buttocks exposed to the wash. We want to put a towel, lengthways under their back and butt. And then we can use our wash mitt to do long firm strokes from the neck down to the buttocks. Wash, rinse, and dry thoroughly. We can do the buttocks front to back, wash, rinse, and dry thoroughly with clean cloths. After we're done, all the linens need to be chucked. And we can take off my gloves. And at this time, we could also remove the gown from the patient, starting on the affected side first. And when we're all done, we want to make sure that patient is in a comfortable position, completely covered and warm. We make sure our rails are up once we're done that procedure as well. At this point, we could also incline our patient and provide them hair care. So we would want to see their preference of hair care and do an inspection on the scalp and through the hair and document any of this. Next, we would assess the skin system and its signs of increased pressure injury. So I would ask the patient for more information about mobility status, sensations, incontinence issues. I would use the Braden scale, which I have here, to assess patient's points, which low number is the high risk. So we want to expose potential weak spots in our patient. We will explain the steps that I'm going to be looking at your bony prominence and high risk pressure areas. And since you're in a supine position primarily, I'm going to get you to roll to your left side again. We're going to look at the heels. We're going to look at the tailbone. We're going to look at the shoulder blades. We're going to look at the back of the head. And we're going to want to look at the back of the elbows and see if there's any irritation or distress to the skin and any breakdown there. When we're all done, we want to make sure our patient is comfortable, position, warm, and our rails are back up again. So next, we're going to provide mouth care. So we want to ask the patient, what is your frequency of brushing? Do you floss? What kind of toothpaste do you use? We want to prepare and gather our equipment, which as you can see I have here. First, I did my hands. I got gloves on. We want to inspect the integrity of the lips, the buccal mucosa, gums, etc. We would normally raise the bed, but since we can't do that, I will just demonstrate myself. I would put toothpaste on the toothbrush for the patient, have them brush their own teeth, I would instruct that the gum line needs to be brushed at a 45-degree angle. The tops of the teeth need to be done in a parallel brushing position, and the side of the teeth need to be done in a lateral position. We would allow the patient to rinse and spit and use mouthwash at this point. We would make sure we clean up any soiled linens, garbage, dispose of gloves at this point. Make sure they are back into a comfortable position after all this. Make sure the handrails are up. More hand hygiene. For the unconscious patient, we're going to want to do similar. We're going to get them to go to the side lying position, test for a gag reflex. We're going to move their head towards the mattress and place the towel under their head. Place an oral airway if necessary, suction excess liquid, brush teeth using a toothbrush, and then use a bulb syringe to rinse the mouth. And we will also want to moisturize lips, raise side rails, and dispose of soiled linens and gloves when we're all done with that. So to wrap up, is the patient comfortable? Do you need anything more?
No.
Do you know where the call bell is if you need more assistance?
Yes.
And then I would leave the room to document all procedures, observations, treatments, assessments, and according to the documentation guidelines.